Hi everybody, Dr. Bob Vaughn, your local health and wellness expert with Health Source of Blaine. Today I want to talk to you about plantar fasciitis, some things you can do at home and some other things that you can do to help with that or any other foot pain that you're dealing with. A lot of people, even some of our patients, are surprised that chiropractors can actually treat plantar fasciitis and quite successfully. So a couple things that we want to look at when we're doing this. First is the actual plantar fascia, which is the bottom part of your foot. It's a big tendon, it gets very stiff and sore. So some things you can do is you can have someone take something like the back end of a reflex hammer or the back end of a spatula or something like that, and you can just kind of scrape through there. You want to go pretty light because that can be pretty tender. That'll help break up some of that tissue through there. Otherwise, you can take like a tennis ball or a lacrosse ball and roll it on the bottom of the foot to break up some of that tissue. Another tip you can work on, and a lot of people forget about, is when you're working with the plantar fascia, is you want to look at the calf, or the big muscle on the back of your leg. This gets very tight because all of our shoes have heels on them, especially when women wear high heels or some sort of short heel, and that shortens the calf muscle. And that's important because the calf muscle attaches on the bottom of the calcaneus, the big bone in your ankle, and what that does when that calf gets tight, it'll actually shift that calcaneus down, and it puts extra undue pressure on the plantar fascia, especially if you have the pain right on the heel or right in front of the heel. So stretching out that calf and working on that is something else that can be beneficial to treat plantar fasciitis. Something else we can do is you can actually adjust the foot itself. So there are actually 26 movable bones in the foot and ankle, and they all have to glide smoothly on each other. So as we take a look, as we go through here, there's a couple different spots we're going to look at, and when we're checking them, what we're looking for first, we want to make sure there's some flexibility in the big toe. So when I pull here, it should spring down and come back up. So she does have some movement in her big toe. We want to check the navicular, which is basically the keystone of the arch. It's the top part of the arch here. If that falls, if you have feet that cave in or have that inversion as they go with that, that can put a lot of extra pressure, and that navicular bone can actually come down and irritate the plantar fascia. So there's a couple different ways you can adjust that. You also want to make sure that the calcaneus is moving smoothly. So I'm just going to show how we would go about adjusting the foot here. So we're going to start with the navicular. I'm just going to give a quick push up. There we go. Move very well. Then we're going to try the cuboid over here. And a lot of these you're just going to feel like a quick pull. There we go. Sometimes you'll hear a pop, sometimes you won't. Next one we're going to do is we're going to get the calcaneus. There we are. And we're going to get the cuneiforms. Just try to let that foot relax. Awesome. Very nice. So that is a foot adjustment, and that's something that can actually be very beneficial to get those joints moving. Now, one other thing you see here is there are some different tapings that you can do with the rock tape. It's a kinesio style tape. And what it does is it helps with a couple things. One, it actually helps support the muscles, so it help turn on inactive muscles or shut off overactive muscles. The other thing the rock tape will do that'll help with this is it'll actually help increase the circulation because it helps lift up the different layers of the skin, which allows for better blood flow of oxygen and nutrients to the area, and also the waste products are able to get out more quickly as well. So that's something we'll use to support the adjustments along with the rehab exercises. All right, now something else you can do if you're dealing with plantar fasciitis while you're working on strengthening and stabilizing that foot to support you when you're outside of the office is you can actually use arch support. Now we use Mojo feet. They either come in the pre-cast, which are semi-customizable. Otherwise, we do the foam casting as well, where we can actually get a cast of the foot. Recommend if you're dealing with plantar fasciitis, we start with a prefab and work our way into a custom orthotic based on how you're responding with that. The nice part about these is they're actually more durable than the regular ones you're going to get off the shelf at your big box store. They last a little bit longer as well, and you see the different lining on here. It's actually a silver nitrate lining, which is antimicrobial. So I jokingly call it the anti-funk, which helps keep the feet a little bit cleaner, keeps things a little fresh, especially if you're wearing them in a workout shoe or something like that. So this is something else that you can utilize as we're starting to strengthen up those muscles if you're dealing with foot pain or plantar fasciitis.